At Des Moines University Clinic, you'll find healthcare professionals with only one priority: you, the patient. Come see us for the very best in family medicine, physical therapy, podiatric medicine, and osteopathic manual medicine. Call today to schedule an appointment.
Welcome to the fall prevention presentation by the Physical Therapy Club. Make safety your call to prevent a fall. The definition of a fall is an uncontrolled descent. So it still counts as a fall if you catch yourself, or even if it's something as simple as plopping down on a chair.
Falls among adults age 65 and older are common, costly, and preventable. Falls are the leading cause of fatal and non-fatal injuries among older adults. Falls among adults age 65 and older are very costly. Each year, about $50 billion is spent on medical costs related to non-fatal fall injuries, and $754 million is spent related to fatal falls. Falls can lead to broken bones, head injuries, and the fear of falling.
On this slide, we're going to discuss tips to prevent falls. The first tip being scheduling an appointment with your doctor. When you meet with your doctor, you can discuss medications and other risk factors that are specific to yourself. Also, we would advise you to meet with your eye doctor so you can screen your eyesight annually. Another tip is to keep moving. Strength and other balance exercises are important in fall prevention, and we will discuss this later on in the presentation. We also encourage you to evaluate your environment. Things like lighting and your specific shoes will be important in fall prevention. We would also encourage you to educate yourself on the different ways that you can be put at risk for a fall.
There are some risk factors that can be modified to decrease the chance of falls. This includes balance impairment, gait, muscle weakness, and the use of certain medications.
So what can you do to prevent yourself from falling? A simple daily mobility and strengthening program will be important to prevent yourself from falling. This can be something like an exercise class, such as Tai Chi, or it can be as simple as taking your dog for a walk.
A physical therapist can identify the exercises best for you after completing an evaluation. Here are a few sample exercises beneficial for improving balance. Heel raises can be done holding on to a chair or counter as shown. You can also challenge your balance by practicing positions such as tandem stance, shown in the middle picture. Always do these with a stable surface nearby. Finally, strengthening your muscles through repeated sit to stands can also reduce fall risk.
Being proactive is the best approach to fall prevention. A physical therapist can help you learn the correct way to fall. When you practice the correct way to fall, you will be prepared and educated in the case of an unprecedented circumstance. These are our references. Thank you for listening to this presentation, and we hope you were able to learn something new.
At Des Moines University Clinic Physical Therapy, our providers are experts in movement and improving your overall health and function. We pride ourselves in focusing on the whole person and develop rehabilitation programs that address the psychological, social, and physical aspects of your pain and functional impairment. Our state-of-the-art facility includes private treatment rooms for your privacy and comfort. The technology utilized by the expert clinicians facilitate the outcomes of the rehabilitation program. We provide general orthopedic rehabilitation following surgery or injury, along with the treatment of aches and pains that occur from aging or living an active lifestyle. We have therapists that have advanced training and specialty clinics for vestibular, balance, and concussion recovery. We also treat many neurological conditions like the recovery from a stroke or Parkinson's disease. We have specialty training in the management of persistent pain conditions and strive to improve the quality of life and to keep you moving. Another specialty clinic is working with men, women, and children that have pelvic floor problems with incontinence or leakage of bowel and bladder, constipation, pelvic pain, perinatal care, or the recovery from cancer or pelvic surgery. Although many individuals may not need rehabilitation, they can benefit from a wellness assessment to help improve movement that will reduce the risk of injury and improve general wellness. The physical therapy wellness exam is designed for all ages as an assessment of an individual's flexibility, strength, walking, balance, and aerobic conditioning.